Hi, it's Dr. Lisa and Dr. Britt here.
Hi guys.
From Errol Chiropractic, and we are live today and talking all things posture.
We are.
How can we get you looking great with that posture?
Well, stick around because we'll tell you how.
Exactly. Do stick around because we're going to talk about what ideal posture is. How can you check yourself or check those around you? And why bother about your posture? Why is it so important? Because it doesn't look like many people really bother about it if you look around. So what is ideal posture? You know, why do we need to bother about it? How do we get bad posture in the first place? And then what are we going to do about it if we feel like doing something about our poor posture? So do stick around, guys. We're going to go through that in a moment.
Absolutely.
And you're probably wondering, what's Lisa got? These little dots.
She's a little shrub. She's a little tree.
I'm a little tree today. Do you like my earrings, Dr. Britt?
I do. Green suits you.
It is my favourite.
I like the big earrings on you.
Thank you.
Just to start working them.
Well, these are little markers. I feel like a crash test dummy. They're actually markers to help you see really what ideal posture is.
Yeah, so they're your postural landmarks, these green dots.
Absolutely.
Yeah.
Okay, so we've got the ears, we've got the tip of the shoulder on both sides, and we've got the hips. Might be a little bit hard to see. Now I should have one also on or two on my knees and then on my ankles. So ideal posture, we're looking at two things. We're looking at you front to back. So our spine, it's pretty easy to figure this one out. Our spine needs to be straight.
Yeah.
And it sits on that pelvis, which is like the foundation of a house. So we want the dots to be level.
Yes, we do.
Shoulders, ears. So we'll go ears, shoulders, hips or pelvis, knees and ankle. So they should be absolutely level. So issues if we've got one higher than the other. Head is tilting, one pelvis is up. Okay, there might be some structural issues going on underneath, or there might be a short leg, which may need some attention.
Definitely, if you're walking around all crooked like that, there's definitely some structural issues going on.
If you feel like you're walking around in circles, you might have an issue there.
Yeah.
And then when we're looking at you on the side, now the spine is actually not straight on the side. So do you want to describe the curves, Dr. Britt?
Yeah.
Because if I talk that way, they're not going to hear me.
So side on, we have distinct curves through our spine. So with our neck, we've got this forward curve. So it's almost from this direction, it's the shape of a C. And then coming down into our back, we have that curve in the opposite direction. So we're kind of not hunching, but we're getting that shape almost like a backward C.
Yep.
And then we come down to our lower back and we get that forward C. So it's almost like your spine goes in a little bit of like a squiggly line in terms of its curves.
Absolutely. So they're normal to have those curves there.
I think a lot of people think that your spine has to be straight in all directions.
Absolutely.
I think that's a really big thing. But front on, straight, side on, we need these distinct curves.
They're super important. We're going to
Important.
why they're super important in a moment. So these dots need to line up.
So,
ear over shoulder, shoulder over pelvis or hip, hip over knee, knee over ankle. So it should be like a plumb line dropping. They should all line up. Okay? So what we don't want to see is, or what we do unfortunately see is this, or we see this, or we see this. Okay? So we want them all to line up.
yes, because you only want your ear just slightly in front of your shoulder. You don't want it all the way out here.
No.
That's not right.
And it doesn't look good either, does it?
And it's uncomfortable. It hurts.
So these are definitely problems that we see associated with a lot of, back pain and discomfort and sciaticas and all sorts of things and, referred pains. So we're going to see postural issues and they're usually underlying, and then other issues will develop on, from that. Fashion accessories. So what do people do? So if you are still having issues with posture and you do need some help, then please give us a call. 9329 1118. We're happy just to answer your questions. You don't even need to come in. You can message us, you can comment below. Do something if you're not sure.
It's a big part of what we as chiropractors do, so we're here to help.
Absolutely. And just check out our website as well. We've got lots of great other tips as well around.
And information on chirobiophysics as well.
Chirobiophysics, yes. And that is the spinal corrective technique that we do here in the office that really helps with those faulty curves.
Yeah.
So yeah. All right, guys. Well, thanks for
Yes.
listening, and until next time,
See you
take care.
guys. Have a good Wednesday.
Bye.